So today's guest is someone whose quiet contributions have profoundly influenced medical care and education across Central and North Queensland. Joining me is Professor Llewellyn Davies, OAM, a retired consultant general physician whose career spans nearly 4 decades of service from Mackay to Rockhampton and beyond, beginning his specialist training in Brisbane and earning his fellowship with the Royal Australasian College of Physicians in 1978. Llewellyn was part of a pioneering generation of general physicians who brought specialist care to regional Queensland at a time when such services were rare outside the capital. From 1978 to 2002, Llewellyn was one of only two physicians in Mackay working tirelessly across public and private sectors to deliver care in cardiology, diabetes, and complex internal medicine. And in 2002, he transitioned to Rockhampton, where he helped establish the University of Queensland's Rural Clinical School and served as acting director of medicine and director of clinical training at Rockhampton Hospital. His outreach work extended to Billawheeler, Warrabinda, and Monto, ensuring specialist care reached even the most remote communities. The dedication to teaching has earned multiple accolades, including the L.D. Walters Prize for Excellence in Clinical Teaching twice. He was awarded the Medal of the Order of Australia in 2004 for his service to medicine and medical education, and received further honours from the AMA, RACP, and UQ Medical Society. Now retired, Llewellyn continues to serve his community through Meals on Wheels and finds joy in gardening, woodworking, and even growing backyard coffee. He credits his wife, Marion, whose Rockhampton roots stretch back to the 1860s, as the dedicated support behind his life's work. And I'm really excited about this conversation today because it's not just a reflection of a remarkable career, but a living piece of local history. Thank you so much for joining me, and I hope I have wrapped up your extensive career.
I think you've done fairly well.
Well, I was very lucky to have so much great contribution from yourself in helping me to understand everything it is that you have done locally here in Rocky as well as beyond.
I guess, I've always felt there are always greater and lesser persons than oneself. And, what we achieve, particularly in medicine, it's the old story about standing on the shoulders of giants. And, you get to see further. And certainly the people my parents and then the people who taught me medicine were the giants on whose shoulders I've been standing.
It's an absolutely incredible career, and I'm really excited to deep dive a little bit into your story and your influences. But before I do get straight into the hard questions, they're not really hard though, I'd like to know if you could be an expert in absolutely anything at all in the world, obscure or bizarre or just everyday normal, what would it be and why?
This is completely unrelated to medicine, but it is related to gardening, and I sort of like growing plants from seeds. I'm fascinated about the longevity of some seeds, and there is a well-documented case of seeds dug up from the Masada site in the Middle East. They've almost certainly been there for 2,000 years and were planted and then grew. So what I'd be fascinated to know about is how seeds maintain their viability over thousands of years. And there may be examples going back even further than that. How does life remain present for that period of time? I think it's a fascinating scientific question.
I agree. That is absolutely fascinating. And I've not heard of that particular seed type before. And I'm not someone who's very good at gardening. I do enjoy it, but I'm definitely not an expert. But that is a fascinating topic.
So that's completely unrelated to most of the other things I've done in my life. Yeah.
That's the point of that question. It's completely unrelated. Sometimes we get so wrapped up in what we do and how we serve and our careers that it's sometimes interesting just to ask that oddball question to have a little bit of a different insight into a person. Yeah. So can you share with us a little bit about your key influences and, your roots growing up as a child and what sort of experiences you had in life that helped to shape your journey?
Yeah, well, I was blessed to have wonderful parents. My my family was a medical family. And I guess you think about going into medicine when you've got dad as a doctor and mum was a nurse, but she had two brothers and a sister who were doctors. But I did sort of aptitude tests in late secondary school, and they said, "Oh, you'd probably be best doing medicines." And I was always just interested in random facts,
Hmm.
pick up knowing about stuff. And I guess general internal medicine's a bit like that. I didn't enjoy wonderful health as a child, and I only found out when I was 12 that I had a significant congenital cardiac problem myself, and that probably would have, you know, finished me up maybe mid 30s, 40 or something like that. And this is before people were doing heart surgery, and it had been tied up with me having pneumonia a couple of times as a kid. Anyway, eventually, in the holidays after my first year at med school, I went down to Melbourne in 1965 and had open heart surgery to repair the defect. Obviously, a successful operation because I'm almost 78, and so it's worked fairly well.
Here to
But it was interesting having that experience of being a patient. I was a long way from home. They
Mm.
weren't doing any heart surgery in Queensland. Being a patient and going through sort of intensive care areas and having your chest opened up and open heart, cardiopulmonary bypass stuff, being on the receiving end was very good education. This is what life is like for patients. And I think that molded my career to some extent. I've always felt very strongly that we ought to put ourselves in the shoes of our patients, and feel what they're feeling. So that was one interesting experience. And I mean, apart from breaking my leg in a football match in grade 12, I couldn't play, but I was being the linesman. I still had my leg broken. And that added to the patient experience, having your leg in plaster for 3 months. So I enjoyed my med course, and I took a year off in the middle of the course. You could interrupt and do a research year and qualify for a science degree, which I did. Then at the end of the course as an intern to decide, well, where are you going to go in medicine? I was very fortunate to have an excellent general physician at Royal Brisbane, a guy called Tom Ferrier, who was a wonderful general physician and very empathetic to patients, wonderful bedside manner, thirst for scientific knowledge. We'd be doing a ward round. We don't know the answer to that. That's a problem. Let's go and look it up and see what the very latest evidence is. So he was a wonderful influence. And then later in my specialist training, I encountered a second wonderful influence guy, a cardiologist, a guy called Rupert Graf at Prince Charles Hospital, who was an excellent model for being thorough and meticulous and conscientious, and was just impeccable ethical behaviour. There were a couple of people and there were others, but having those sort of influences was good. I enjoyed doing general med. I think I was probably better at doing that than I would have doing hands-on, cutting doctor stuff.
Mhm.
And then I had to decide the animal specialist training where I was going to work. And the best places to work in gen med are actually in regional areas, because without being too snooty, some of the interesting stuff in the big cities gets siphoned off by the subspecialists, the pure kidney doctors, heart doctors, whatever. If you're one of two specialist physicians in Mackay, the nearest alternatives were either 400 or 1,000 kilometres away. And, mostly you had to get along and do it. So you never knew what was coming in next. It could have been some obscure neurological condition. It could have been complicated diabetes. You didn't know what was in the waiting room. And I found that very interesting.
It would have been incredibly interesting. And yeah, the variety, absolutely, that you'd be able to have exposure to in regional Queensland is not something I guess that we think about too much in today's modern world of access to better medical care than what we would have had back then.
Yeah, so back in the 1980s, 70s, You couldn't evacuate people from Mackay easily. We didn't have the RFTS easy transport option, and we'd have to try and lie people down in commercial aircraft. And so evacuating people was actually very difficult. And that put the emphasis on, trying to do it locally. And, we didn't have CT scanners, let alone MRI and PET scanners and things for a long period of time. We didn't have ultrasound, cardiac ultrasound, which I got into, came in the mid-1980s. So a lot of it was hands-on, examining the patient stuff. The technology, tests and things have become so sophisticated that I think doctors these days often don't focus on physical examination, whereas we had to try and take every last morsel of evidence on physical examination to try and make diagnoses and make decisions about treatment. And I think it's one of the, probably less attractive things about modern medicine. We don't actually put our hands on the patients so much as we used to. So it was challenging. It could be very worrying when you had people who were very, very ill and, you didn't have access to perfection in diagnosis and treatment. And, we were essentially working 12 days out of every 14.
And it would have been a lot of pressure, I can imagine, as well.
Yeah, well, we're on call, for both the public and private. And I've always worked in the public system right from the word go, and I'm very enthusiastic about having a strong, well-funded public hospital system. And one thing we all need to keep on the pressure about is that they're going bankrupt every year because they can't afford medical bills.
Yes, no, that's absolutely right. So with a family of people in the medical industry or medical fields, did you ever think to yourself you might go down a different path? So even though your aptitude test said, "Oh, yep, well, you better be a doctor or you better go into medicine," was there ever any was there a point where you thought to yourself, "Yes, absolutely, this is where I'm heading"?
Yeah, late on in secondary school, I did have an interest in aeronautical engineering. Always been interested in planes. I was in the air training corps, like the Air Force cadets at school, and I, read up about aeronautics and how planes flew. I'm still interested in planes. I go down to Plane Spotter's Corner and look at the planes here in Rockhampton. I probably wasn't quite good enough at mathematics to do aero engineering. I think you had to be a real whiz to do that. And medicine worked out eventually. But so, yes, that would have been quite different.
Would have been very different, yes. No, that's interesting. And I bet your parents and your family were very proud that you did enter the medical field.
They were, although, I feel strongly, one of our kids has done medicine, one of the four, and people say, "Oh, you must be proud of him." And we say, yes, we are, but we're proud of all the other kids too. And I think, as long as people are good people, you share the same amount of pride in what they're doing, irrespective of what their vocation is.
Absolutely agree.
So, yes, and my medical forebears did different things. My father was a plastic surgeon. He wasn't sort of, tummy tucks and facelifts when he trained. He actually did his plastic surgery training during the war in the army, which was all, hand grenades in the face stuff, not cosmetic. He was up on the Kokoda campaign, and not that he ever wanted to talk about it. So, he'd seen the rough end. And then he was the only plastic surgeon in Queensland till about 1960. And now I think there's, 60 or 70 plastic surgeons. Dad was doing it all.
And they certainly wouldn't have the experience. Not, I can't talk for all of them or any of them really, but they wouldn't have that same experience that your dad brought to Queensland.
No. And I had an uncle who was an eye doctor and another uncle who was a GP. And so I didn't strictly follow down the same medical path, but did chose my own, pathway within medicine.
Yes. And how do you feel being in Rockhampton specifically? So since the early 2000s, coming home to Rocky, how that's shaped your journey and how that's contributed to what you've achieved in your career?
We've enjoyed it. Mackay was a good place to live, and all our kids went through school in Mackay. But I was really attracted by coming to teach more in 2002. And Rocky is my wife's hometown. She still had family here in Rockhampton, and that was really good. And people in Mackay used to be funny. You're going to move to that terrible hot place, Rockhampton, but really it's a 6 of one, half dozen another. You can have a couple of degrees less heat in Mackay and more humidity, or a couple of degrees more heat and less humidity in Rocky. So, but
Yeah.
regional cities are great places to live. I really wouldn't want to go back and live in the big city now. I occasionally visit my brother who lives in Melbourne, and I really wouldn't want to live somewhere with that degree of traffic crush, busyness. Not my cup of tea. And you get to know people in a smaller community. You'll walk down the street, you'll see this person or that you know from one field or another. But
Mm.
and that certainly happened in Mackay, whereas in the big city it never happened.
No,
So
that's right. I spent a short time living in Brisbane,
yeah,
so I
and I
am
mean,
familiar with what it's like, the difference between the city and the country.
here we can, get in the car and you're out of town in 10 minutes.
Yeah.
And, people talk about, it's so hard to get to the airport in Brisbane. And I say, oh, I can actually walk to the airport in 20 minutes from where I live, possibly not carrying a big bag, but
Maybe a bag on rollers might be
yeah,
a little bit
that's
more
right.
practical. Oh, no, that's good random information for you. I was actually born at the Mackay Base Hospital
All right.
in
Yeah.
1985. My dad worked for the railway, and we were based at Serena, and the Serena Hospital didn't deliver babies at that time. So I was trekked off to Mackay when it was my turn to enter the world. I do
Well,
have a love for that town.
my first job, my intern year started with 3 months on secondment to Mackay as an intern.
Mm,
Very beginning of my work as a doctor, and my field at Mackay Hospital was the obstetric ward and the geriatric ward, sort of coming in and going out of life, as it were. It was a much, much smaller place in 1972, and it wouldn't have been a lot bigger in your day either. But there were some, very fine doctors. I worked for a chap called Gresley Lucan, who was the obstetrician in Mackay at that time. He was a wonderful man, and again, a great model. Goodness, we worked hard. I think I figured we were working about 100 hours a week when I started as an intern in Mackay.
that's incredible. Mm, it would have been work, sleep, eat, repeat. I can imagine.
It is.
Yes.
Well, you sort of worked and slept, and I was engaged at the time, but there wasn't any time to, waste money. I saved $1,000 in 3 months. Then 72, there was a lot of money
Yes, it would have been.
able just to get married.
That's that's a bit yeah, special, I guess. Being engaged and having probably not seeing each other very much either.
Well, not in those 3 months. I think we saw one another once during that time. But yeah, my wife was a student. She didn't graduate until the year after we married. It's a bit of a cradle snatcher, but anyway, we're still here 53 years later.
Yeah, I think you're doing all right. So tell me, either end of the scale or both, really, but can you think of something, whether it's been a significant challenge that you've had to overcome or an extremely proud moment, just a moment in your life that's really shaped your perspective, something big?
Look, it's hard to say. I mean, I've been pleased with outcomes in a number of patients, where I mightn't have expected it. And I guess I've been proud of a whole lot of things in my life, my kids and family and medical achievements. I mean, I can think of the occasional major life-threatening emergency where we actually pulled somebody out of a tricky situation, and those things are always good. And forgotten, might have been just a few weeks after I arrived in Rockhampton, and the director of medicine gave me a call, and there was a lady relatively young lady in her 30s, who'd come in with a critical problem where fluid builds up outside and around the heart, and it compresses blood flow into the heart, and so blood can't get into the heart, can't get out, called pericardial tamponade. And this lady's blood pressure was extremely low, 60 on nothing much. And she wasn't going to survive being transferred to Brisbane, would have died. And I was the only person who was trained to do cardiac ultrasound and potentially remove the fluid. And, that sort of thing, big responsibilities. Lady with little kids, and You really had to do it and do it safely. Obviously, when poking needles in toward the heart, you don't want to go in the wrong place. But we drained the fluid out, and blood pressure shot up, and I have occasionally seen that lady at the shops, and we exchanged pleasantries. Um, so, things like that obviously stick in one's memory. Obviously, you have disappointments in medicine too, and times when you feel things could have gone better. But, that's scientific medical care, I guess. You're always looking, how do we improve situations? One of the things that helps us a lot is online information. In the old days, the internet, you had to keep all your medical journals and keep all the stuff in your head and have a whole range of books. And if you wanted to know new information, you'd access those, you'd ring people up. But now you can tap into Medline database and hit the button and bing, that's the whole list of all the reputable peer-reviewed articles about the information you're seeking. And that's made a world of difference, particularly in regional areas.
Yeah, I can imagine. I can't eat well. For one, I'm not in the medical field, but for the second point, I can't imagine how, like, medicine in itself is such a significant field of study to treat. You never know what's going to come at you, and then to have all of that information within, or be able to access it, in books, for example, and not have the access that I've grown up with my whole life. I just can't even begin to imagine what that was like.
No, well, of course, now we're in the situation of having too much information and misinformation. And, I really look at some developments in the US at the moment where we have what's really just garbage being promoted as public health policy. And it really worries me. We're dissuading people from vaccination. We've really forgotten about the benefits of vaccines.
Yeah.
No.
And the reason why we don't have the diseases that we did have in the day.
Yes. Well, there were still people who were contemporaries of mine at uni who'd had polio and were in wheelchairs and things. And, once you start dissuading people from vaccinations, that's what you'll have. People getting encephalitis after measles and, just terrible things that, okay, vaccines have this infinitesimal rate of side effects, but like 1 in a million, whereas your chance of having life-threatening complications from the disease is often like 1 in 100, 1%.
Mhm.
No question about which path to take.
Yeah.
But everybody's an expert now.
Yes. Dr. Google, if Dr. Google made some money, he might be a trillionaire. Yes. I'm sure GPs today are very frustrated by the patients that have come in and self-diagnosed using Dr. Google. Or even
Yeah.
AI now, like all of the AI popping your symptoms, tell me what's wrong and be misled.
It'll probably be helpful, but it'll have to be tempered by the patient who's actually sitting in front of you and that you've laid your hands on and talked to. It's not going to be a substitute for personal care. And the other thing is not just getting it right and getting the diagnosis and treatment right, but treating the patient with respect and dignity.
Mm.
I was asked to give a sort of parting lecture by the Rural Clinical School in 2014, I think, when my contract with the RCS was winding up, and my topic was human dignity in healthcare. I don't subscribe to the view that, when you go into the medical system, you leave your dignity at the door. I think that's wrong, and people always need to be treated respectfully and in a dignified fashion. It doesn't matter whether they're the governor or the garbage man. Everybody deserves respect. I could have given a talk on, the latest treatment of diabetes or whatever, but I thought that was probably more important as a message to the medical students.
I think that would have been a brilliant parting gift. And I can imagine you've impacted or influenced a lot of lives and a lot of medical professionals because of giving that. Today, you're volunteering with Meals on Wheels and keeping yourself nice and busy with woodworking and gardening and maybe learning about seeds. Tell us a little bit about Meals on Wheels and what you do there.
I'm very pleased to have that opportunity because it's a very important organisation. I'm just one of the volunteers. So every day, teams of 2 people do about 14 Meals on Wheels runs. And mostly elderly people, occasionally people who aren't so old but are incapacitated for one reason or another. So every run might have anywhere between 8 or 10 and 25 people to deliver meals to. So the fresh, nutritious, very good food cooked in a top-level commercial kitchen there at Berska. And we always deliver between 11 o'clock and 1:30 or so. Most of those people, if they didn't have meals delivered regularly, would be in some kind of institutional care. We could probably be delivering more meals, but there's so many people waiting on care packages that subsidise the meals that, they've got to wait till the packages come through. Look, it's a good social activity for the volunteers. You get to talk to your opposite number as you're driving around. You get to see a new part of town. I didn't know anything about Park Avenue when I started delivering meals about 5.5 years ago, but I can find my way around Park Avenue blindfolded now,
Oh,
which
I
is
think I can
my
tell.
run. So it's a very important service. So anybody who listens to this or watching it who's moved to do something for the community, even if you only do one day a month, it's better than nothing. I do 3 days a week, but we have a good group of people. Some volunteer activities you end up with, I don't know, toxic personalities who make life a bit miserable. I've got to say, all the volunteers' meals are wonderful, and
Yeah.
staff are wonderful, and the people we deliver to are wonderful. And it's a pleasure to meet them all. So there you go. Free ad for meals.
No way. Rachel Speechley, you may know her. She works for Meals on Wheels. She used to live in
Yes.
Rockhampton and now she's in southeast Queensland. And we used to be dance mums together. And
Yes.
she's obviously a huge advocate for Meals on Wheels. And I know any promotion or any messages we can get out there for that service, she will be more than happy with both of us.
It's very important. We tend to be a fairly old group, the volunteers. We've got people well into their 80s who are still driving Meals on Wheels and some of the longer runs. So most people retire in their late 60s these days. And you think, well, instead of sitting there watching daytime TV, come along.
And you make friends and you have fun and I would imagine it would be quite rewarding to meet all of the people that you provide the meals to and check in on them every three times a week that you do, and just for that bit of company for a couple of minutes. And
Yeah, our motto is not just a meal. So we're always doing a welfare check when, how are you going today? And, if we can identify people are in trouble, slipping back, then we tell the office staff and they'll get in touch with next of kin. And, it's a bit different from just having your frozen meal box dumped on your doorstep once a week and nobody inquiring how you are.
yeah, absolutely agree. So aside from it's obviously very rewarding to do that work. What keeps you driving forward every day? Like, what keeps you going, to do this work and to stay active and, be with your family?
Yeah. I mean, I guess one of the major bases to my life has been Christian faith. My wife and I met one another at a church student camp, and that's been, the basis of our life ever since. And, trying to do something for other people's been important. I think if you're not doing something for other people, life loses its meaning a bit.
Agree.
We even think with our gardening, well, we're gobbling up the carbon dioxide with all our plants and trees and cooling the suburb down.
That's a brilliant way to look at gardening. The next time I go to Bunnings, I'll use that excuse.
That's right. We ought to have more trees.
We do.
We're involved with the native plants outfit locally, and it's interesting. My wife knows way more about plants than I do because she originally trained as an agricultural scientist. I'm the gardener's helper. But yeah, that, and I mean, the other thing is 4 kids and 5 grandkids, and there's always something to be interested in and follow up on there. 2 of our kids are local and 2 are away. So that's another thing that we've had a lot of joy from, following up family and keeping in touch with my wife's family here. It's fortunate to have two sisters who live locally. I hope that there'll still always be something in life that one can do to try and help others.
Yes, absolutely agree. And I have one more question for you before we wrap up today. If you could give a piece of advice to the generation coming along after yourself and the many generations coming along after both of us, what would it be from 2025? What would that advice be?
Yes, it's always hard, isn't it? I mean, this idea that, there'll always be greater and lesser persons than yourself. Even if you're achieving, humility is a great virtue. Don't be too embarrassed and worried. I mean, we look back at our teens and younger life, and we're so worried about, little, did I get that award or didn't I? And I mean, all those things are a bit immaterial in the long run. So don't be too self-conscious. Try and be nice to people. A bit of humility goes a long way. Please and thank you. All those sort of simple things we were taught also go a long way. Those sort of messages, I think.
Perfect advice. Thank you so much for joining me today, Llewellyn. I'm very thankful that you were able to give me some of your time. And yeah, I'm very excited to share a little bit about your story, your impact, and your advice, and a lot about Meals on Wheels with the audience who'll be listening to this podcast.
Well, that's wonderful. Yes. Okay, it's been a pleasure talking to you, Nyree.
Thank you. Pleasure is all mine.
Okay, good.